Welcome to All Things Chiropractic.
Welcome to another episode of All Things Chiropractic. I'm Paul Andrews.
Hello, everyone. I'm Dr. Mark Davini.
The episode today, this is about dry needling, which doesn't...
We're going to make more than a few points.
It doesn't... Even the name itself doesn't sound too appealing to me. It's a needle and it's dry. A lot of people are scared of needles, right? I mean, that's a legitimate...
It's a legitimate thing for sure. But let's face it, it's a growing modality. It's something that we get a lot of questions about, truthfully. You know, whether you can or can't do it. Is it or is it not part of chiropractic? So it warrants a discussion.
So there's a few points that I really want to talk about. But before that, let's Doc, have you just tell us a little bit about what is dry needling? Like what is it and what does it do?
In broad strokes, it's really a treatment for soft tissue, myofascial release types of treatments. So you might say it's almost comparable to the outcomes of a manual therapy treatment technique.
Yeah.
So the idea is to break up adhesions, to release the fascia. It's soft tissue for sure, as opposed to, say, something like acupuncture, which has more of an energy component attached to it.
So when we talk about the technique of dry needling, now, in disclosure, Tools of Practice, we had hosted a couple of these classes a few years ago. So we bore witness to what this looks like. And I have to say...
I sat through most of it, and yes.
I'm not sure if I would want it done on me, because you have this pretty good size gauged needle, which is solid typically, right? Driving through trigger points and muscle, like really deep.
Really deep. I saw one dry needling needle that was like 3 inches long for getting into the thigh. And I'm thinking to myself, I had a different perception of that before the class. I was thinking it was more like acupuncture, where you get these little fine needles that you do almost sub-Q. You know what I mean? Some type of shallow penetration of this needle, though I know acupuncture has variations where they go deeper. But I'm just saying, it was not, I've had acupuncture. I just thought it was this variation of acupuncture.
Yeah.
So let's state it right up front. Dry needling and acupuncture, completely different.
Yes, because I also have had acupuncture, and I can tell you that it seemed very, very different. Very different.
Yeah, and it's very effective. People that use it, both chiropractors and physical therapists, very common. Those that do have it as a treatment love it. They think it's very effective. I know it's very effective, I know it's very effective, but it is very, very different. It's done for different reasons. It's done in different places. It's not acupuncture. It'd be like saying just because they use a needle, it makes it acupuncture. And that's totally wrong.
I want to get into that argument, but before that, from an analogy standpoint, I think of it this way. Acupuncture is like the effleurage of massage, where dry needling is like the Graston of massage.
I like that.
Do you know what I mean?
I do. I like
there's
that.
such a different, a very hostile approach almost. Do you know what I mean?
I don't know if you're getting this, but there seems to be a little bit of attitude towards
Well, it's trepidation
needling.
because, I mean, I'm not a fan of needles. I give blood, so I needles isn't that big of a deal, but it is from a massage. I'm a massage therapist, so from my more modest approach to soft tissue versus aggressive, it's a pretty aggressive.
And I agree. I mean, and it's out there. And one
not to dissuade you.
No, not at all, Paul. We're getting it.
I don't mean to do that. But, yeah,
no, we're definitely getting the impression you love it.
Yeah.
But there are definitely states out there where, along with your chiropractic license, you are allowed to do acupuncture if properly trained.
Yeah.
And that incorporates most of the time dry needling also, as far as scope of practice goes, not that they're the same things, but scope of practice. So this is very common out there. In some states, physical therapists can do it.
Mm-hmm.
And because physical therapists can do it, a chiropractor might say, well, if they can do it, we should be able to do it. Because what they do, if it's in their scope, it should be in our scope. So there's a lot of moving parts taking place when it comes to dry needling.
So let's talk about the territorial battle between these licenses, because we've seen it in some states, including our own, that written into either rules, regs, or policy, there's this, yes, dry needling, first of all, is not acupuncture. That argument, I think, goes away in a lot of reasons why. Let me tell you a few of my justifications as to why dry needling is not acupuncture. And it's not even just about the different approach and how the needles are different typically, and the depth in which they are inserted are different. Let me fall back on our trusted AMA CPT coding. Because AMA has come out back in 2020 with dry needling CPT codes. And they are not the same as acupuncture codes. They are different.
So there it is.
Right?
There it is.
I could say, just based on that alone, that if the coding system, which sometimes I'm not a fan of the coding system and how they interpret things, but they have created these different codes, and the descriptions of these codes and the clinical examples of these codes differ from acupuncture.
So we're not the only ones who think there's a difference between acupuncture and dry needling. They're two different disciplines.
Right.
It'd be like osteopathy and chiropractic. We both use manipulation. We both use adjustments. We both put our hands on the spine, but they're done for a different reason. They're done in a different way. They're done under a different protocol. It's different. Osteopathy is not chiropractic, and chiropractic is not osteopathy.
Well, and actually, I had a conversation with a chiropractor who's also an acupuncturist recently, and I asked her about dry needling versus acupuncture. And she acknowledged that there are similarities to them, but she did acknowledge that they were not the same thing. So as a result of that, to me, the territorialism of this debate really we should move past it, because one, just because it's in scope for one professional license doesn't mean it can't be in scope for another professional license, right? So now we're talking about market share. And if that's what we're talking about, you're not doing your job, board members, because it's about public protection. It's not about your marketplace.
And here's an interesting, just to further the debate, an example of sort of one permutation of all this is that in Massachusetts, acupuncturists have a license that's separate and distinct. And here, it's given to them under the Board of Medicine.
Yeah.
But yet, physical therapists and chiropractors can do dry needling. But they can't do acupuncture. So, by definition itself, it's separate and distinct, and done for different reasons and done in different ways.
Yeah. I think the debate about acupuncture and dry needling being the same is pretty much moot at this point.
Mm-hmm. I agree.
But what it comes down to now is, in my mind, when you go to school, chiropractic school, are you learning dry needling today? Not 100 years ago when you started school, literally. But like
when it was,
when BJ was your teacher,
that's right.
So, but I mean, I really don't know the answer to that, whether they talk about cover dry needling or if it's, sort of an elective or not.
Some schools, it's exactly what you just said. It's one or the other or both, so that because certain states allow you to do acupuncture and dry needling as part of your chiropractic license. So the schools may teach it. They may teach it as an add-on. They may teach it as part of the curriculum. And if you were going to a state that didn't allow it, then you just, you didn't do it, or you won't do it. So yes, it's all of that. It comes down to an interesting debate, though. Just because you can doesn't mean you should. So there are those that say acupuncture is not chiropractic.
Right.
So why do you get an acupuncture capability just by virtue of the fact that you're a chiropractor?
Well, in some states you can, I guess, if you have the training. In others you can't unless you are.
Right. So
Yeah.
it's sometimes I get confused when I'm thinking, why is this even
A thing.
a thing?
Hmm.
I can't do surgery. I can't prescribe medication. I don't want to do any of those things. But I'm saying just by virtue of getting my chiropractic license doesn't allow me to do things that are involved in other disciplines. But for some reason, acupuncture has been bundled with your chiropractic degree. In some states, that's perfectly legal. So the extension of that now is we have chiropractic, we have acupuncture, and now we have dry needling, which is, they all have been around for a long time, but now we're separating them out as disciplines that are separate and, distinct disciplines. And some states allow it, some states don't. And then the question is, do you want to or not want to? I sat through that course that we talked about that we put on. And my only conclusion at the end of that course was I am not even close to qualified to do this now.
Right.
All you've done is told me all the reasons why I need to learn more.
But to me, that's good, because now you know that. And that goes into my thoughts about the risks, right? Not because you're a chiropractor learning it, but anybody learning it. Like, we've run into, issues with some of our members who have done this, and there have been some negative side effects.
Right, because they haven't been trained adequately.
Right.
But here's the thing. When we talked about regulations, and I believe one of our other podcasts, we talked about this a bit. They allow you to do it, but some states wouldn't define what the educational requirements are to do it. So sometimes you can do it with very little education, which means you're going out there and potentially putting patients at risk that they wouldn't otherwise have if you were more proficient at the technique.
Right.
Okay. And there are dangers to it. There are risks to it, just like everything. There's risks to everything. And if you're going to take on something like this, which again has proven to be a very effective modality, get good at it.
Well, that's number one, right? So to me, the question would be, well, then why? Why, if I'm a chiropractor and this is really sort of like an adjunct, why would I bother to want to do this? And I guess some of that's probably personal, right?
Yeah, we're into a philosophy discussion now. Yeah.
Well, maybe it's just about money. Like,
and it could just be a marketing discussion,
right?
I mean,
it's probably going to be, for the most part, a self-pay, cash only, quote unquote, service, because depending on the state that you practice in, the reimbursement for it may not be there. Typically, probably not. Some states maybe a little bit, or maybe under workers' comp or motor vehicle, you might pick it up. But other than that, it's self-pay. So, okay, you say this, well, if I actually like that, because then if it's self-pay, then I don't have to wait for my money. Then, I'm helping the patient.
Now, it also takes a lot more time. And, I could be treating 5 chiropractic patients in the time it took to do 1 dry needling patient.
Well, but much like acupuncture, right? You could run multiple tables at the same time, or offset by a few minutes, right? Because it's not even about it's about the needle going in, but it's about the time that the needle's in too, right?
And you always said that, you tell your people that you do billing for that, treat the patient, don't treat the claim.
Yeah.
Right. Well, we should be treating the patient and not your pocketbook. So if your motivation for doing dry needling is because you are providing a service that you feel has such value that couldn't be achieved in other ways, please go out and do it. Run with it, because then it will work for you. But if you're doing it because you're just trying to find another thing to charge your patients for, and you only do a cursory course in dry needling, just enough to get by or satisfy a legal requirement, you're not doing anybody any favors. Because first of all, you won't be successful with that practice because your mind isn't in the proper place for it. And your patients won't respond to it because you're not really you're not using it in that healing mode that your mind needs to be. So it's all self-inspection when it comes to this.
Well, and there is a bit of an investment here in reality. So, you need a space for it. You might already have a table for it or not, or if you're going to run multiple. But now you're dealing with sharps, right? So there's a whole different aspect now to your practice.
Blood's involved.
Right?
Blood is involved. Sometimes there's
emergency accident plan on this, right?
Yeah.
And so there is a lot of considerations beyond just the application itself, which takes mere moments to do, but all of the things around it And how are you going to support that and educate yourself? I think it's pretty clear that a weekend workshop is probably not going to be enough.
No.
Yeah.
No.
It might give you a taste,
Right.
and
Like
then you
I
can
said,
decide, do I want to do
all
this?
I learned in the weekend was everything I didn't know.
Yeah, right. I mean,
Yeah.
we put that, it was what, 12 hours or something
It
we
was a
put on?
12-hour
And
course, yeah.
I dare say it didn't seem sufficient.
No, it's enough it satisfied the requirement if somebody wanted to go out and do it. But like I say, personally, my only feeling was that I learned everything I didn't know.
Yeah.
And that if I wanted to do dry needling, I would have to go further in my education path and learn it in a way a lot better than one weekend could give me.
Right. So, but that's not to say that it isn't an effective modality. I think there are, there's a lot of approaches to it that would allow for relief, I think. And
since it's really strongly focused on myofascial release and trigger point types of therapy, yes, you add it to your toolbox, add it to your Graston toolbox or your rock tape toolbox, add it to your ART toolbox or your myofascial release, types of techniques. It's another way to do something that there are other ways to accomplish. And you as a practitioner has to decide whether or not you want to add it to your repertoire of techniques. I'm an activator practitioner, but I also am a Gonstead. I'm proficient in Gonstead. So that means that maybe sometimes I'll do it this way and sometimes I do it that way, as opposed to saying, nope, I'm only a Gonstead practitioner and I'll never do it differently. So it depends on your practice philosophy, your belief system, how you want to present yourself to the public, all of that. And then if you decide to do it, please go out, get a good education in it so that you minimize risk to patients and become most effective.
As the chiropractor in the room, where do you see this like fitting in or complementing the adjustment?
I consider it a modality, just like all other modalities. I consider the chiropractic adjustment the primary procedure of what we do. Nothing touches the adjustment. All the other secondary procedures or supportive procedures will assist components of the subluxation. So maybe there is a muscular component that will respond to the adjustment only, but maybe it might take longer for that muscle to relax or that adhesion to break up or whatever. So I use a modality. And I would put this in my list of modalities to say, I want to release this fascia. So I have in my toolbox what we just said, ART. I have Graston rock tape. I have, now I have dry needling. So to me, it's not the be all end all, as opposed to, for example, acupuncture, which as a discipline is presented as a be all end all. It's a technique for healing the body, but also to enhance its wellness, like we believe chiropractic adjustments are. It helps relieve certain ailments, but we also believe there's a wellness component to it. So acupuncture is more all-encompassing than dry needling. It would be the difference between the adjustment and performing an ultrasound to assist the adjustment. Well, acupuncture is all-encompassing, but dry needling may adjust a specific component of that patient's problem, like a trigger point.
It's funny because it made me think of a friend of mine who's passed away now, an acupuncturist. And he was doing his doctorate. He had been an acupuncturist for a long time, but he wanted to go back and get his doctorate. And he did his thesis on the curing and healing effects of relaxation. And his point or his approach even with his acupuncture practice was as much emphasis, if not more, on the time between the insertion of the needles. Yes, where they go and how they go is important, but it's that time where the patient is just still and assimilating and relaxing and the positive effects of that in the healing process, which I thought was really interesting.
It is, and again, it's all these things you incorporate into practice. And as a chiropractor, in my mind, in support of the adjustment, not in replacement of, and certainly not as effective as the adjustment in and of itself.
it lends to a quote from Voltaire. Again, someone
Voltaire.
you heard primary source probably. The art of medicine consists of amusing the patient while nature cures the disease.
And that's it.
Right.
Are you trying to be the person who consciously directs the change? That's allopathic. I'm trying to tell the body what to do as opposed to ask the body what it needs. And BJ used to always say that if you're consciously doing something for a specific purpose, then you've become allopathic, as opposed to doing what the body asks you to do for it and let it heal itself. What's the old saying? You don't need any interference, right? I mean, you don't need any interference with the body for it to heal, right? That's the whole approach of chiropractic. Sometimes chiropractic can be, we'll say, executed allopathically. I am treating the pain. And that's okay if that's your discipline. And if that's your discipline, this is another modality for you to use to treat pain. But if you believe that the adjustment not only can heal someone's pain, which I actually said that incorrectly, the adjustment doesn't heal the pain. The adjustment removes the interference and allows the body to heal the pain, and maybe even something more than that, then dry needling just becomes supportive at best.
Clinically, take me through this, right? Because I'm a massage therapist, and my approach with my clients is not about forcing the issue when it comes to working on them, whether it's a trigger point, it's myofascial release, whatever it is. And my perspective of dry needling and other modalities, doesn't have to just be dry needling, is you're forcing the issue. Like Graston, you're forcing the issue.
Mm-hmm.
Maybe it's just my philosophical approach wouldn't be that.
Well, probably, I would say, and I agree with you, as a chiropractor, I always wanted to ask the body what it needed and gave it what it needed, not necessarily what my conscious brain thought that it should have. And that's the problem, is medicine always looks at you and says, you have an inflammation, take this pill to get rid of the inflammation. Maybe the inflammation was good.
Yeah, why do you have the inflammation?
You don't necessarily know that. But if the body asks you to do something for it, and then it will decide what it wants to do or not do, then that becomes healthy. So it could be the difference between, say, the massage that you just described and Rolfing. Very aggressive, right?
Yeah.
Very directed. They're making choices about where they want things to be and how they want your body to react. The practitioner is making a conscious decision on what they think is best for your body, as opposed to, as a practitioner, giving the body, through whatever means I have, giving the body what it's asking for and allowing it to heal itself.
See, I agree with that because, I don't know, I'm sure it's just philosophical. I would have a hard time even, learning some of the techniques with soft tissue, instrument adjustment, that would be bad. Instrument assist on these myofascial release tools. I would never want to go to that aggressive, pull that blood up to the surface real quick and cause or inflict pain. And maybe that's just because massage I don't think of as should be painful. Now, maybe a sports massage, if you're trying to work somebody who's active, who's going through something, okay, that's a different story, but you just get onto my table and I'm going to sit there and push something through.
Well, here's a perfect example of being subtle and asking the body, right? If you did any form of kinesiotaping, you put this piece of tape on a part of the body that's tight, or maybe even a slight amount of pain to it or whatever, and the pain is gone, or it's no longer feeling tight. It's like, wait a minute, whoa, back this all up.
Yeah.
All I did was put a piece of tape on your back.
Well, yeah, but not really.
But not really.
Yeah.
Because there's all these, according to those who teach it, all this neurological input, proprioceptive input that comes from just having the tape there. And then allowing the body to receive those signals and respond to them in the way that the body wants to. And that's what an adjustment is. You ask the body what to adjust. That's what all the techniques I taught when I was in school, I was taught with techniques that we ask the body what to adjust, not where does it hurt, I can't tell you how many times I adjusted people who had neck aches and never touched the neck because the body didn't tell me to adjust the neck.
Right.
We just let the body heal itself.
And then the patient's like, why aren't you adjusting my neck? It hurts.
And it was always a struggle sometimes when that did happen. And, and we know that commonly if somebody had neck pain, they're probably going to be a subluxation here somewhere. But I wouldn't adjust the neck just because they had neck pain. I adjusted the patient where the subluxation, my technique indicated where the subluxation was, and then adjust the patient and let the body heal itself. And that's dry needling is directing the patient. I'm telling this trigger point to go away by sticking a needle in it, as opposed to giving the body what it needs and hoping, in a sense, that the body will recognize that trigger point and make it go away. And sometimes it's either beyond the body's ability to heal by itself, or it may take more time than the patient wants to wait, and you might enlist some type of supportive procedure to assist the primary procedure, the chiropractic assessment.
I guess I get that. I guess, in principle, that sometimes a more aggressive approach to help force something to change is there. I also get the other thing because I work on patients, right, and or clients. And they're like, oh, my back, I get this knot, and I start on the occipital ridge, and they're like, what are you doing? I was like, this is where your trapezius attaches, or one of the places. Like, we're going to work from one end and try to smooth out the blanket, from one, and they're just like looking at me like I've got 10 heads.
Yeah, I was like, unfold that quickly.
I might be in the wrong place. I need an adult.
and that's the challenge, is making patients understand why you're doing and why you're doing it. And if your approach is directed toward the area of pain, it's less explanation for sure. If your approach is more holistic, then it requires some explanation. And we've said this over and over again, that a self-pay practice isn't easier. It's just different than an insurance practice because it requires more education. Same thing with dry needling. You go, if you're going to incorporate something that appears to be so different from everything else you do, it just requires that attention and education.
And there's another psychology of the patient you might have to overcome, which is needles that you don't normally deal with in your practice.
2 and 3 inch long needles.
Maybe not show them. Hey, this is what I'm going to stick into your thigh, like 3 inches. But but I mean, there is that aspect of it that you have to be confident about. I guess it goes to like everything, right? You can't sell what you don't own,
right?
So
that's exactly
right. And you better own it. And I think our collective opinion here is that maybe use a weekend workshop to expose yourself to it, but not feel so confident to just dive in on Monday.
Right. Remember, Jim Parker used to say that statistically, it's the 80-10 and 10 rule. 80% responds and gets well from chiropractic, 10% improve, and 10% don't respond. But the difference is my 10% may be different than your 10%. So a lot of chiropractors will say, I am going to add modalities to my practice to mitigate that 10%. And maybe I can reduce my non-response rate to a lower percentage because now I have more tools in my toolbox or tools of practice.
Ooh.
So, but boom.
So I was looking for quotes on dry needling, like some,
Go ahead, stick it to them.
No, it wouldn't be. This isn't. Maybe it was just me, but they all came into like fear and courage because of needles.
Isn't that a bourbon?
Right. Yeah, right. But Mark Twain said, courage is resistance to fear, mastery of fear, not absence of fear.
Right.
So if you're fearing needles or you're fearing maybe exploring this, master that fear and take a look at it. Why not?
Yeah. Master it through your education.
Right. And don't let Paul Andrews dissuade you.
Please.
From dry needling, because it wouldn't be something I would do or want to do.
Exactly.
I'm open to it. You know what I mean?
He's trying to make a point.
Oh my gosh. Wow. On that note, thanks again for joining us for another episode of All Things Chiropractic. I'm Paul Andrews.
Dr. Davini.
You're there.
Thanks for listening to All Things Chiropractic. We'd love to hear from you. Visit allthingschiropractic.com with comments, episode ideas, or questions. or connect with us on Facebook and Instagram at All Things Chiropractic Podcast. Be sure to join Dr. Mark Davini and Paul Andrews next time for another episode of All Things Chiropractic.